Emily just arrived, and I think I've got one more person coming.
Have you decided when the mock exam is going to be?
I'm hoping to do it on the 16th. I haven't gotten confirmation on a room yet.
Okay.
Yep, that's right. Okay, so did you do your previous post?
Mm-hmm. I have the printed off grades right here. I just have to write them down. That was
So then that final, you said you took that today?
no, I need to take it.
Sorry. You're going to find out when our last class is.
Yeah.
And put that there. And then you can actually just scan that in and email it to me
Okay.
when you're done.
Thank you.
All right. So tonight is coding CPC exam review. And this is the book that you should have been working out of. And the pre, the post, and the final are on Evolve. Can you hear me? Am I loud enough?
Yeah.
So tonight is really about answering questions for you about the pre and the post exam, going over the handouts that I sent you in an email. You either had the chance to do them or not. If you didn't, that's okay, because they were extra practice to be able to, answer your questions here in class. So, some of you are either completely done and ready to take the mock exam, and some of you aren't, and that's okay too. But this is to give you tips and tricks.
This is me. Thank you. It's nice to meet you. Hi.
Kelly, hi.
Nice to meet you.
Nice to meet you. Emily.
Hi. Thanks. I didn't think we were going to need all our books back.
That's okay. That's good. We were just starting. I was just letting everyone know that you should have been working out of this book already. Some are to that point and some are not, because this is a recording. Some people will be at different levels when they listen to this. Hopefully they have finished everything. You got 2 handouts via email, and those you either have worked on or not. And then you had the pre and the post exam that you have completed on Evolve. And if not, that's okay too. And then you all have different types of books. You either have this HCPC Level 2 book, or you have the gray one. And you have the ICD-9 book, or you have the ICD-9 gray one. And then you should all have the CPT book. Now, these are the 3 books that you will be allowed to have in the exam. So it doesn't matter if they are the small gray ones. Let me see. Which is like this. Or the big ones that I just showed you. So tonight is really about answering questions for all of you and giving you some tips and tricks to get through the exam. Because if you've already done the pre and the post exam, it's a little different because you're doing it online. Okay? I personally found it harder to do it online than to do it on paper. So, Lisa, let's start with you. where are you at in your studies with the review book?
I have to still do the post exam. I've done the pre. At the halfway point, and hopefully I'll get done with it soon and be able to take the post.
Okay, great. And Kelly, how about you?
Okay, well, I took the post today because I wanted to have them both for the class. I wasn't sure if we were going to need them. I took the pre-test about a week ago. I got 87. And then I got through half of the review book, pretty much basically terminology, which was where I had not reviewed in quite a while because it had been a while. So I went up 4 points on terminology when I took the post because I went all the way through that part of this book.
Okay.
And I used my terminology book kind of as a post, kind of cross-referencing everything. And then I got a 93 today when I took the post test. So
Great.
that's where I am.
Okay. And Emily?
I took the pre and the post, and I'm just about halfway through. I think maybe a little bit less or more.
Okay.
Sure.
So you're going to want to finish the exam review books, though, before you do the mock exam. And if you don't join me for the mock exam, you at least want to finish the book and sit for the mock exam on your own. You're going to do it the exact same way that you took the pre and post. Schedule 5 hours and 40 minutes of uninterrupted time as much as possible. But this time, you're going to do it out of the book. And then you're going to go on Evolve and enter your answer and get your score.
Jordan, is the mock exam for you the same that's in our book?
Yes. Yes. I actually have you bring your book and we tear out the bubble sheet. I actually make copies of the bubble sheet so you don't have to tear it out. And we just take the exam that's right out of the back of the book. So you're able to have this book, your exam review book, plus your 3 books. So we simulate it as much as possible like the national exam. You can bring snacks as long as they're quiet. You can bring a drink. Number 2, pencils. In this case, you can use a pen, but I would suggest try to make it as much like the national exam as possible. And wear layers because we never know if it's going to be cold or hot. And know where the bathroom is because the time will not stop for you. So keep that in mind when if you do the mock exam on your own, do not stop the clock. Time will not stop for you. It is 150 questions, and we average about 2 to 2.5 minutes per question. And so if you haven't been timing yourself the last several chapters in your book, I suggest that all the practice work you're doing, you time yourself. And that's a little bit about what I do tonight as well. When we do some of these handouts, I actually start the timer and see how well we do. Okay. Now, you've all seen the tabbing, and you've all done some tabbing in your books. You remember that if you have white space in your books, write in it, because that's where your notes, your terminology, okay? So how would you remember where to find it? Put a tab there, terminology. Prefixes, suffixes, combining forms, just terminology, all right? But wherever there's white space, if it applies to a certain system, make sure you're using the white space in the front in your CPT book. Okay, that's going to be probably the quickest place to go to is the front of those guidelines. And, just put a tab sticking up, notes, just so you have that reference point. Or guidelines, so you have a reference point to go back to certain notes that you have. Yes?
So the proctor's not going to have an issue if she sees that in the middle of my Hicks books I have like a column of all of my abbreviations.
No, because you have some in your CPT book. You just cannot have loose leaf paper or sticky notes. Now you can bring in index cards, rulers, or scrap paper to kind of keep line on your bubble sheet. Okay? Because your exam booklet is a little bit different than this. You can write in your exam booklet, and you can make little tick marks next to the one that you didn't answer so that you can go back to it, but that's where you need that index card or ruler so that you don't lose your place. And then start marking off the wrong answer and realize 100 questions in that you just marked the wrong answer for the last 100 questions. That wouldn't be fun. Okay. So, did you bring any questions with you tonight about the pre and post? How about the handouts?
I didn't get to the handout.
Okay. Did you bring them with you? Okay. Did you?
Honestly, I don't know that I saw them in my email. I don't.
Okay. How about you, Lisa?
Yeah, I have that.
Okay. So the best I can do then is read them out loud to you, and then do you have scrap paper? Okay. And we can go over some of those. We can even take some all right, so people ask me, how much is the mock exam like the real exam? Well, all of the assignments that we have in these sheets are supposed to be live experiences, life experiences. Okay? They might be old, but they're still live experiences. What I heard from a couple students over the past month or so is that the national exam did seem harder. And it can and it can't. It just depends on your perspective, I guess, and where you are at in your knowledge level and your background. For me, I really didn't see any difference in what we're learning to the national exam. For someone who has no healthcare experience at all, probably harder, okay? If you are a logical thinking person, it probably will be harder. If you struggled throughout the course, trying to find the whys and what ifs, it might be a little harder. That means you just have to develop those skills a little more, okay? So, let's just pick some random ones. You know that they're going to put it by system. So the exact same way they did the pre and post, you're going to have 10 questions out of every section. So you might have terminology, pathophysiology, ICD-9, HCPCS, practice management. Okay, you might have some from every section, and you just won't know which section. They'll label it, but your exam won't be the same as your exam and your exam. Everyone will have a different exam. So the 10 different sections you have might not be the same as the 10 different sections you have. All right. All right, so this one, just write down some notes. This one has to do with
Which one are you doing?
integumentary system. Actually, we can just pull them right from the back of your book. So you can use your CPC review book. What we'll do is we'll just pick some randomly. All right, so the first one we're going to take a look at.
Yeah.
Let's take a look at number 45 on page 494. All right, so it says, remember we have to keep in mind 2 to 2.5 minutes. But we're reading, and then we're trying to look up. So this is just going to be a test right now, okay? Page 494, number 45.
Thank you.
Okay, bear with me just a moment. Hi, we don't have anyone in the Gardner office or the Gardner High School. Could you just put it in, please? Yes. Yeah, I want them disconnected. There's no one there. That's okay. Thank you very much. Okay. All right. Maybe that will be a little quieter. Okay. So, I know you've already started looking it up. Stop. Stop. Okay, so this is where we learn a few little tips and tricks. All right, so let's just read it first. What CPT and ICD-9 CM codes would be used to code a subsequent encounter? Subsequent encounter, okay? In which a split thickness skin graft, both thighs to the abdomen, measuring 45 by 21 centimeters, is performed on a patient who has third-degree burns of the abdomen. Documentation stated 20% of the body surface was burned, with 9% third degree. The patient also sustained second-degree burns of upper back. Okay, so we have to take and figure out here, first of all, it's a subsequent encounter. We have split thickness skin grafting, both thighs to the abdomen, 45 times 21 centimeters. Third degree burns, 20% of the body surface was burned, with 9% third degree. Okay, both thighs to abdomen. So, do you need to look up your burn chart? Or do you think you can just figure it out?
I can figure it out.
Okay. So then we want to know which code down below. So how are we going to eliminate the two codes that are probably incorrect right off the bat? We want to take a look. We know 15100 times 2. How do we know that that one is not correct?
Because you have to use an add-on code for anything past the first.
Correct. So right off the bat, you can put a line right through that code. So that's number 1, already eliminated. Okay? So then, if you look real quick, and you look at, let's just pick D. Okay? Would D be correct? It's possible. So the next thing we have to do, because we've eliminated one, is look up those two codes, 15100 and 15101. Okay, so 15100 is split thickness autograph, trunk, arms, legs, first 100 square centimeters. Perfect. Okay. Second is the add-on code 15101. Each additional 100 square centimeters or each additional 1% of body area of infants and children. We don't know. Let's see. We don't know if it's an infant or a child. Okay, so we're going to have to assume based on those codes. Or part thereof, separately in addition to code for primary procedure. So we know we're using these two codes. Now it's a matter of are we timesing it by 9, adding the modifier 51, or timesing it by 8? Kelly, what do you think?
I'm thinking it's D because you don't round up when you're doing the square centimeters. So for the first 100, you get the 15100, and then for the next 800, you get 15101 times 8.
Okay. All right. So how many square centimeters do you think we have?
945.
Okay. So we have at least an extra 100. So if we do the first 845, we still need to account for that extra 100. So in this instance, we would do times 9.
All right, you did lose me.
Okay.
So if it's 945 total, the first 100 brings me down to 845. But I do round up?
Yes.
Okay.
Yes. And then what we have to do to check ourselves is the diagnosis codes. So if you know for a fact the first two CPT codes are correct, all right, then go and check your diagnosis codes. So what we have here is 9493. And sorry, we eliminated A, sorry. So eliminate A. So in B, C, and D, we have 942.33. Do we have it in another? No. We have 946? No. 948.01. We have 948 in all three. And we have 942.24. What are we looking for? We're looking for third-degree burns, right? Third-degree burns are the most severe, so those would be the first diagnosis code.
I was going to also eliminate C because you can't have a modifier 51 on an add-on code.
Excellent, yes. So A and C, gone. So if we do third-degree burns as our first diagnosis code, what would our first diagnosis be? The third degree burns happened where? Of the abdomen. So go to abdomen, third degree, 942.33. And if we go into our tabular, (942.33), full thickness skin loss, third degree, not otherwise specified. Then we would have to choose the 5th digit subclassification, and we would want to choose 3 because it's of the abdominal wall.
Doreen, is there a place in here that shows the order of the burn classification coming after the actual burn code?
In your book, let me just take a look if you don't mind. Okay, so here we have 90%.
Well, I got the code. It's
Yeah.
definitely 94820, so it has to be B. But where in here does it tell me that this code has to come after these two instead of in front of it?
Okay, well, let's look at it. Because this is primary,
That's over here. That's the actual burn, and this is the classification of the burn.
this is the other 20% of it. Because if you look,
That's the 4th digit, and then the 5th digit is how much is 3rd degree,
right,
and that's the classification of the burn. The other 2 codes in B are the trunk and the back
right.
burns. How do I know that the trunk and the back are sequenced before the classification of the burn, or does it not matter?
Well, because it's the degree.
So the
The
degree.
degree of the burn would be first. In this instance, it's the abdominal wall, which is the severest. It's the 90%.
Okay, so it's the which one's the worst goes first, and then
Yes.
the next one, and then the classification afterwards.
Yes, because we had 20% of the body surface being burned with 90% third degree. Well, that 9% was the abdominal wall. So that was the most severe. And then the patient sustained 2nd degree burns of the upper back. So then you would do the 2nd degree burns and then indicate that 20%, that classification that you were mentioning.
And so for all burn codes that I do, I'm always going to have a classification.
Sometimes
Not always.
you would probably about 98% of the time have a classification if they're indicating the percentage.
Okay.
Okay? All right, so you see how we tore that one apart? I know we didn't go quickly. But that's the idea, is to try and eliminate the 2 incorrect ones as quickly as possible, and then take the other 2 possible ones and confirm which one is more appropriate. So if we know right off the bat that the two procedure codes are correct, but that modifier 51 isn't, get rid of it. Okay? So we know that the primary encounter reason is 3rd degree burns. That should be your primary diagnosis. So guess what? We know it's B. We just need to confirm all the diagnosis codes to be sure. So what I would do is, because we eliminated A and C, I would, just for the heck of it, go to 94801. Confirm 94801 was not my 3rd degree burn code. It's gone. So you see how quickly we can do that. We were just doing this one slowly to tear it apart, so we got to focus on how to do it. Does that feel good for you?
Mm-hmm.
How did that work okay, Lisa?
Yes.
Okay. So let's try another one. All right. Let's do number 48. Over on page 495. All right, so number 48. What CPT an ICD-9 code would be used to code the destruction of a malignant lesion on the skin of the female genitalia, measuring 1.6 centimeters using cryosurgery. So what we want to look at here is what system?
It says of the skin.
Right. So if I go to 17262 right off the bat, it tells me destruction of malignant lesion. Okay? So I'm going to go pick another one for just the heck of it. 11622. And 11622 just tells me that it's an excision of a malignant lesion, excise diameter 1.1 to 2.0. Well, it would fall within that. But am I excising a malignant lesion or am I destruction?
Destruction.
So 11622, you're gone. Always try to compare two as quickly as possible to see which one you can get rid of. So right now, 17272 is in the front running. Okay, 11602, because I'm already in the 116s. Okay, 11602 again is excision of a malignant lesion. Gone. So that leaves me 11420. And 11420 is excision of a benign lesion. Guess what? My answer is
Okay.
A. And I haven't even touched the diagnosis code yet. So you can eliminate these as quickly as possible, sometimes by just one code. And it's all because we pay attention to the category heading. So the 116 was excision, but the 172 was destruction. So we have to pay attention to that because it's specifically said in there, destruction of a malignant lesion. All right, let's see. Did that all make sense, Kelly?
Yes.
Okay, great. All right. Let's do a same-day surgery. Let's do number 49. Okay? So this one is an inverted nipple with mammary duct ectasia left. All right? So we can probably pretty quickly get rid of A and C, right? Because there's no LT modifier. So we can get rid of A and C really quick. Okay, so then we're going to look up 11404 versus 19120. And this is where you want to have multiple utensils to be able to put in between your pages so that you're not constantly flipping back and forth, that you don't lose your place. All right, so what did I say? 114. I gotta get the right book. So 11404. Okay, 11404 is excise diameter 3.1 to 4.0. All right, and it is an excision of a benign lesion. And they're telling us here okay, and then 19120. So the 19120 falls underneath category for excision, and it's a breast surgery. And 19120, excision of cysts, fibroadenoma, or other benign or malignant tumor, adherent breast tissue, duct lesion, nipple or areola lesion, except 19300, open male or female, one or more lesions. Well, right off the bat, 19120 is more appropriate than 11404. I'm not even going to check my diagnosis code. I'm going to go with D. And the answer is D. Now to confirm, because because they're two different diagnoses, I would double check just, if I had a little extra time. But if you're 98% sure that CPT code is correct, move on. Okay? You want to get through the ones that are quick and easy as quickly as possible. So your terminology, your practice management, those types of things. Try to get through those quicker, okay? These surgery reports and stuff like this, you will be able to if you can flesh them out quickly, like we're doing. Does the process make sense to all of you? Lisa?
Yes.
Okay. All right, let's try another one. All right, let's do 52 on the next page, 496. All right, 52. Now this one's a little longer because you've got CPT codes and diagnosis codes. What CPT and ICD-9 codes would be assigned to report an initial encounter for treatment of a 40 square centimeter debridement of an open anterior abdominal laceration, including subcutaneous tissue and muscle with grit and rubble? The patient fell while speed walking and landed on a sharp rock, injuring the epigastric region of the abdomen. So, where do you start? I'm going to start with the bottom one because it has all those other diagnosis codes with it. So I'm going to get rid of B because it's removal of foreign material at the site of an open fracture. And 11042 is debridement of subcutaneous tissue, including the epidermis and dermis if performed for the first 20 square centimeters, and then each additional square centimeters, but it's subcutaneous tissue. In the exercise, it's actually subcutaneous tissue and muscle. And if you look, it only has one diagnosis code with it. So the first two I would try to get rid of are the ones with the short diagnosis codes, because he injured himself by falling on a rock. So we have some E codes, external cause codes. So for me, it's between A and D. So then I'm going to go to my diagnosis codes and see which are more appropriate. Is it 879.2 or 879.3? And 8793 wins. So I'm not even going to continue with the rest of those diagnosis codes. I'm going to pick D. So it's picking out those words. So we had...
Was it anything about that made you feel it was complicated, or did you just know that because I'm going with procedure code on that one.
I thought you might. Because in this instance, if you look back at... You're talking about...
It was a matter of whether it was complicated or not, and that was tricky for me.
yes.
So, because I was thinking it wasn't, but I trust my diagnosis code, my procedure code.
Right. So in this instance, because there was grit and ripple,
Okay.
okay, that makes it more complicated.
Okay.
And then the fact that he injured the epigastric region when he fell, okay? If you think of it this way, it's like layers. The more layers you have, the more complicated it will be. If it's just an open wound, there's no real cleaning out of anything, then that wouldn't be complicated. That would be without mention of complication. So the fact that my garden shears attacked my foot last week and I ended up in the ER, then there was just flushing it out. There was no removal of anything, okay? So that would just be without complication.
Would flushing it out be debridement, though?
A form of debridement, yes. Like washing, yeah. Okay? So D for 52. All right, let's see here. All right, let's turn to page 498 and pick number 57. All right, so we have John, who is an 84-year-old male, tripped while on his morning walk. He stated he was thinking about something else when he inadvertently tripped over the sidewalk curb and fell on his knees. X-ray indicated a fracture of his right patella. With the patient under general anesthesia, the area was open and extensively irrigated. The left aspect of the patella was severely fragmented, and a portion of the patella was subsequently removed. The remaining patella fragments were wired. The surrounding tissue was repaired, thoroughly irrigated, and closed in the usual manner. So really here, you only have 2 CPT codes to choose from. And only 2 diagnosis codes really to compare. So 27524 is open treatment of a patella fracture with internal fixation and or partial or complete patelectomy, patellectomy, and soft tissue repair. 27520, closed treatment of patella fracture without manipulation. Well, we know it's open, so get rid of B. So then we're narrowed down to the diagnosis codes. So 822.0 is closed and 822.1 is open.
8221.
This one's a little tricky. Pay attention. And then I would just compare my E codes. Okay? What do you have, Lisa?
Oh, still getting it.
Okay. Kelly?
I went with the striking against an object for 880.1, thinking that the cement was the object,
Okay.
because I thought it was better than an unspecified fall for 888.9.
Okay.
So I was to A and D, and I went with A because of the.
Okay. Emily?
I don't know. I haven't gotten there yet.
Okay. We'll wait for Lisa. We'll let Emily catch up. That's all right.
I think A also.
Would it be D?
Okay, perfect. I'm glad you chose D. And let's look at why, okay? Because the answer is A. All right? The answer is A. And what I said to be careful because this is tricky, okay? You have two different things going on here. 822.0 and 822.1. That was a little tricky because one was open, one was closed, right? And the patella fracture was actually a closed fracture. It only became open when they went in and opened. Okay? So we got rid of B because 27520 was incorrect. But that didn't eliminate the 822.0. Okay? So then E880.1 versus E88.9. E888.9 is for unspecified. They specifically tell us here he tripped over the sidewalk curb. Okay? So what I thought was going to trip you guys up was the fact that it was a closed fracture and an open treatment.
I figured they wouldn't need an x-ray if it was open.
Perfect. So Lisa, don't second guess yourself.
I did.
I heard you.
Yeah.
But why did you second guess yourself?
Because I was doing it as an unspecified fall, not onto the object.
So when you're in doubt, just stay with your first choice. Okay? All right. Let's see. Let's go over to page 501 and do number 69. And this time I'm going to time you. Okay, so don't start. Hold on. I use my stopwatch.
Wait, which one were we doing?
Number 69 on page 501. So I'm not going to talk this one out loud. You're all going to be on your own. Okay? We ready? I'm going to give you 2.5 minutes, and when I call time, just stop. Ready? Go. time.
Oh my Lord.
Okay. Emily, what did you get?
B.
Kelly?
B.
Lisa?
B.
Perfect. How far did you get?
I finished it.
Okay, Kelly?
I was just checking the diagnosis code
Yeah.
for kicks and goes.
Lisa?
Yeah, I was just checking the 20280.
Okay. If you can grab it with the CPT code, forget the diagnosis code if it's a single diagnosis code. We want to move on quick. Okay? And Emily, you started bubbling in your book, right? Early on in class.
Mhm.
Kelly, did you bubble any of your books when you?
I do brackets.
Yep, fine, perfect. And Lisa, how about you?
Yeah, bubbled and highlighted.
Okay, good. Oh, as you can see, I do the same thing too, so. All right. So we're not going to do any more of the book because I don't want to ruin the mock exam. But you get the picture. How's that? Why don't we try some from the handouts that I brought? And I know you don't have them, but what I'll do is I'll read them and I'll put the multiple choice answers on the board so that you can just choose from those. Is this helping?
Yes.
All right, and we're going to time them from here. Okay?
Which one are you doing this from?
Hold on, I'll tell you. Okay, so this is from the Test Your Knowledge handouts that I sent you. I sent you 2 of them. This is Test Your Knowledge, and then there was a chapter review. So the question for this one is, there are 2 malignant lesions on the scalp, measuring 1 centimeter, 1.1 centimeter, and 2.0 centimeters, and 1 malignant lesion on the neck, measuring 2.2 centimeters, being destroyed. Electrocautery was used for the first 2 lesions, and laser was used for the 3rd lesion. What procedure codes are reported? So I'll read that. 2 malignant lesions on the scalp, measuring 1.1 and 2.0 centimeters, and 1 malignant lesion on the neck, measuring 2.2, were destroyed. Electrocautery was used for the first 2 lesions, and laser was used for the 3rd. All right? Begin. I'll repeat it as you're doing it. 2 malignant lesions on the scalp, measuring 1.1 centimeters and 2.0 centimeters, and 1 malignant lesion on the neck, measuring 2.2 centimeters, were destroyed. Electrocautery was used for the first 2 lesions, and laser was used for the 3rd lesion. I'm gonna give you time to do this one. There's a copier down the hallway. Let me see if I can make copies.
Let me know if you see a cutter in there.
Yep.
So did you do all the classes or did you do it online?
I went to all the classes so far. Yep. Did you do it online?
I did. I started a little bit after and then I crammed to catch up. Where do you live?
Right here in Topsail.
Oh, do you?
Right down the road.
I came over down from Camden. I figured to go to one class.
Goodness.
I liked doing it better online when I went to, but I wasn't sure what she was going to cover, and I thought it would be nice to go to one class.
Mm-hmm. Okay, cool. I have a hard time with online. Paying attention. My baby at home, I don't know how much I pay attention. Yeah, I have a hard time with that part.
I keep waiting for them to like talk about something that's not in the book. And so I always have my ears perked for something. I'm like, oh, wait a second, what did they just do? And I'll rewind it.
Mm-hmm.
But I'm running around doing stuff, listening to it. It's hard. I find most of it in the book.
Mm-hmm.
there were certain lectures that I was very careful to listen to, but
Mm-hmm. It is.
I'm sorry, my cough is really annoying.
Yeah, good.
I aspirate on my own self, so I'm not contagious, but I cough a friggin' lot.
I do too. It's okay.
So I have a hard time with this. Did you say you just took one exam, not both?
I took the pre and post.
Okay. Did you compare your answers to see which ones you got wrong?
No.
This is driving me nuts. I'm trying to go through it, and this is the answer key, but I don't know. I'm like trying to remember what I picked and which ones I got wrong,
no.
because I want to know which ones I got wrong.
Right. I
And
haven't done that yet.
it's driving me crazy. I don't know if I can. If I'll go back online, I don't know if you can see what answers you picked or not. I think it just says your score, and then it gives you the answer key. So unless I want to do the whole exam over again with the key and try to remember that way, but like I would have to. I think I'd have to look up the codes and be like, oh no, I didn't pick that one.
Probably.
So I'm going through it trying to figure out. I mean, some of them are obvious, but the ones with codes, not so much.
Right.
Oh, this was one I had a hard time with. I think I got this wrong. Wait, I'm not that one.
Okay, sorry about that. There is a cutter in there if you wish to have a cutter.
Nice. I have 2 copies of the answer key. I thought somebody might want it.
Okay,
I didn't need to make 2 copies.
that's okay. So I just have this test your knowledge that printed out. If you two could share it, I asked that copier is more than I can handle. Did we lose Lisa?
I think so.
Okay. So, you can see there right on the top. So let's answer this first one. All right, so what do we know we can get rid of right away? A. Yeah. It's too simple. Okay? Honestly, it's too simple. So get rid of A. All right? What's next?
looked up all the codes, and then I looked up at the board. I forgot to look at the board and compare it.
Okay.
So I went straight for C, because the other two only have 2 codes. And by
Perfect.
the time I was finished, I either had 1 code or I had 3 codes.
Okay. We had 2 different excisions here, 2 different lesions. We had the neck and the scalp. So we have the multiple procedures going on. If you looked up 17272, now I don't remember these off the top of my head, but I don't think this covers both the neck and, okay? So when I first did this, eliminated these 2 because we had duplicate CPT codes here and here. So I knew it had to be one or the other. It was just a matter of confirming what was this one, because I knew that this probably had to do with the second and third. So that's how I did that one. All right, if you look at the next page, turn to the next one. We have in Test Your Knowledge, number 2, it's an operative report. Possible basal cell carcinoma. I'll write the answers up on the board and give you girls time to look at it. When you're both ready, let me know and I'll start the timer. Okay. Let's go. What I'll do is I'll put the answers on the board and then those who are following along online, it's number 2 in Test Your Knowledge. One, 4, 0, 6. Okay. So we have basal cell carcinoma as our pre-op. Post-op is basal cell carcinoma. After undergoing adequate general anesthesia and DuraPrep, prepping the left thigh and draping with cloth towels and drapes, 0.25% Marcaine with epinephrine, total of 30 cc's was used to anesthetize the skin. A lesion slightly over 4 centimeters was observed on the patient's left thigh. A small portion was removed and sent for frozen section analysis. This returned basal cell carcinoma per prior consent. We removed the remaining lesion with a 0.75 surrounding margin. Due to size and location of this lesion, the decision was made to harvest a full thickness skin graft from his left lower leg. Lower leg was prepped and draped. 0.25% Marcaine was injected. Excision of 5 centimeters by 5 centimeters full thickness graft was obtained. And it's time. When placed on back table for prep, we returned to the thigh area. All edges were trimmed and the graft was placed into the defect and sewn with a running 3/0 visceral. The skin edges were approximated with a running subcuticle number 4 and further sealed with Dermabond. Hemostasis was well controlled. The wound was irrigated with normal saline. What you're really concerned with here is your pre, your post, and your procedure performed. All of the other stuff is going to be fluff until you get into the codes. So how did you approach this one, Emily?
Started looking up the procedure codes, the different ones, and
So if you have codes where you have multiple, identical codes within each line, probably safe to say that you want to start with those first. So like 11406 and 11402. Those are close enough to go look at them in your CPT book really quick.
Mhm.
And then you rule out one.
Right.
Then you go to 11606 and 11602 because, again, they're in the same, you don't want to be flipping back and forth. Okay? So we know that here we have identical, here we have identical, and here we have identical diagnosis codes. You could also possibly do this based on just the diagnosis code. All right? So for time's sake, start with the diagnosis code because you have one diagnosis code. I would go to this one and this one. So then what you would be stuck with is, do I pick, this one or this one? So which one did you pick?
The 11406.
What did you do, Kelly?
I did. Well, I didn't look up anything besides the procedure codes.
Okay.
Because whenever there's 4 different procedure codes, you don't need to look up anything else. So I
Okay.
just skipped everything.
Okay.
So I went with the procedure code, and I came up with the 11606.
So B. It's B. Okay?
If I get nervous and I don't trust myself, I start looking at the other codes.
Okay. So, if I understand you correctly, you went based off of this?
No, I skipped everything. I saw whenever I scanned first all the numbers to see where the commonalities are, and there's a lot of commonalities in the diagnosis.
Yeah.
And then I looked to see the procedure codes, and sometimes there's like 3 are the same or 2 are the same, but when all 4 of the initial procedure codes are different,
Yeah.
I don't read anything else.
So you did just these?
I do only those 4 because only one of them can be right.
Okay.
And once I find the right one, I don't look at anything else.
So then you go, you didn't even check the diagnosis code? That's pretty balls.
If I'm nervous, I check it. But if I know that my procedure code's right and I don't have a doubt about it, I skip and I go on to the next one.
Okay, just be careful,
I know.
because that can come back and bite you. Okay.
I had like an hour and a half left over when I did the exam today.
Okay.
And I used, for anything that I was nervous about, I did the bookmarks.
Okay.
So I went back and I did read quite a few. I changed 2 answers, but none of them were diagnosis codes. They were all other questions.
Okay. Great. Okay. Perfect. So you can do it several different ways. Okay. In this instance, you have the choice of just the diagnosis codes. In Kelly's case, because we had 4 separate primary procedure codes. Again, try to group them so that you're only looking in that spot first, that you're not going back and forth. And again, have multiple utensils so that you've got them to mark your pages. Okay? All right, good. Emily, you picked 11406.
Yeah.
Why? Tell me why.
I don't know now. Exercise.
Do you need to go get some water?
I aspirate.
Okay.
So it's the more I drink, actually, the more I choke.
Okay.
I don't know why I chose that one.
Okay, well, what's 11406? Tell us.
That's it's a excision. It's over 4.0 centimeters.
It's perfect except for that.
Thank you. The carcinoma. It's a benign lesion. Why didn't I? I just wasn't paying attention. That's why.
Okay.
Thank you.
What I do is I go in and with my highlighting, I actually underline benign, and because
I need to go.
I
on a
only
different
do that
color.
if there's no malignancy, like later on in the pages.
Right.
But once you go through like all the codes in an entire section bubbling them, you go back and you see what's the difference between this bubble and this bubble. And then I know what to underline.
Right.
So first I look at the difference between which is in these subdivision, these indented codes. But then I also go to see what's the difference between that bubble and that bubble. So I can go right to when
Okay.
I'm looking at the different bubbles.
Perfect. You can have my job.
I didn't do it the first chapter or 2 that I was doing it, but once I got into a groove, I got pretty quick about it.
That's the hard part when I'm doing the lectures. Because when I'm speaking in the lectures, believe it or not, what I'm saying is what you should be following along with in your books, in your CPT books. So all those words, the benigns, the excisions, the malignants, the centimeters, those are all things that you should be highlighting. The age, the less thans, the greater thans, neonates. Those are all key words that you should have highlighted throughout.
And then if you're comparing it to the answer and you're just double checking to see if you picked the right one, you look at every underlined word to make sure it matches your paragraph.
Right.
There might be something in there that you hadn't looked at yet that you didn't even realize was in here. And you'll go back and you'll see that's underlined and it'll match. And if it doesn't match, you better start looking for another code.
Right.
And that doesn't mean there's going to be one.
But
Yeah, at
you
least
want
you
to just
double-checked
double check.
Right.
Perfect. All right, let's try. All right, let's try on number 4 on test your knowledge. All right, I'll put the codes on the board again. You guys can read that. Let me know when you're ready. I'll start the timer.
I'll make you the answer.
We know it. Did I give you one that showed the answer?
It's okay. I'm going to do it anyway.
Okay.
You doing number 3 or 4?
Number 4.
Oh, I'm doing
Oh, you
one
are
then.
doing number 4. Okay.
Well, then we've got 50-50.
And I apologize, but if you have the handouts at home, you know that it's number 4 in test your knowledge. And basically, you should be giving yourself 2 to 2.5 minutes. And for this one, the 55-year-old patient complains of an injury to his right hip heading to a probable dislocation that occurred 1 hour prior to arrival. The patient states he was sleeping in bed and fell off and landed on his right side. Patient denies numbness or tingling. Patient denies any further injury, no additional complaints or treatments prior to arrival. So what procedure codes are reported by both physicians? And that's what you want to look at here, both physicians. Time. Okay. Kelly, what do you have?
I have to guess. I didn't get to the last one.
Okay.
C?
Emily.
I didn't finish it, but A? I don't know. I'm just guessing because I didn't finish it.
Okay. So 27257 versus 27250 is closed fracture versus a manipulation. So what do we have here that they did? It is patient's gentle traction. Okay, so 27250. It's 27250. Closed treatment of hip dislocation, traumatic without anesthesia. 27257 is with manipulation requiring anesthesia. So the key there is they did the hip dislocation because he hurt his hip, whereas the other one was with manipulation with anesthesia. Get rid of it. So you can get rid of A and B right off the bat because those are the with anesthesia, the manipulation. Okay? So then we want to know, all right, what code here? These are identical, so we're going to look up these two. So what's 01200 versus 99149? And they say you can't memorize these codes.
I'm sure you've got a few memorized.
I do. Oh, 01200, that's back in. Okay, so 99149 is age 5 years or older, first 30 minutes, moderate conscious sedation. And they talked about giving him conscious sedation. So 01200 is anesthesia.
No.
99149, conscious sedation. So
whenever you see anesthesia, it's either topical or general, but never conscious sedation, moderate, blah, blah, blah.
right. Right.
Well, that's a good thing to learn right now.
I know, I'm going to go home and I'm not going to be able to sleep because I'm going to be overwhelmed here. My husband gets upset with me because I can't go to sleep and he's ready to pass out. All right. Do you have page, let's see here. Let's look at, let's do a short one. Do you have number 10? Okay, let's do number 10 and test your knowledge. Number 10. Number 10. A 36-year-old who is 37 weeks pregnant with twins goes into labor. Twin A is delivered vaginally with no complications. Twin B is delivered via cesarean section because the cord is wrapped around the infant's neck. The obstetrician performing the deliveries perform the prenatal care and will follow the patient throughout the postpartum period. This is the patient's first procedure. What procedure code or codes are reported? What can we get rid of right away?
First two.
First two. And because it was vaginal versus the C-section, okay? What do you think, Emily?
D.
What do you think, Kelly?
C.
Tell me why.
Because they're both technically right, but you have to order it so that the most expensive one comes first.
Yes! Ding, 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 ding! Absolutely. So 59510 versus 59400 is what?
Cesarean vaginal.
Very good.
There's where.
Yes, other things to keep in mind when we're coding is the higher dollar value, not necessarily the, the most severe like we saw with the 3rd degree burn, okay? With your diagnosis codes, it's going to be the most severe. With your CPT codes, it's dollar value in the first procedure. Good work. All right, let's do a crazy one. Do you have number 14? Test your knowledge, number 14.
Yeah.
I'm not going to write this one on the board. Or should I? Test your knowledge, number 14. Tell me when you're ready, and I'll start the clock.
I hate E&M. Ready?
Okay, what can you get rid of right away? You can get rid of A because it's an established patient. A, the patient's not established.
I gotta put in my book, I don't know. So for the same reason, you can get rid of B,
Why?
because that's also a new patient.
Oh, I'm sorry. 99213. It's the. Okay.
So it's actually, it's 203 and 99203 and 99204 are new patient.
Right. So we
And
get rid of B and C.
99213 and 214 are established patient.
Yes. So we get rid of B and C right off the bat. I was incorrect. I'm not going to list those out. So then it's down to 99213 versus 99214, and what's going to get you here is the levels.
Right, so if you go to the MDM is moderate, then you have your answer.
Yes. Because
Although
basically-
theoretically, I'd have to go back and read everything to make sure that I had detailed versus expanded, because it doesn't say it outright, does it?
No, it doesn't.
So if it turns out that I only have enough for an expanded, problem-focused, then it's gonna have to be 213. And that
Correct.
the MDM alone isn't gonna carry it.
Right, so what you could check here real quick is your diagnosis codes. And the one I would check would be this one, because all the others are the same. See how you can get that one? So it would be this one, 99214, because this is,
Vomiting
right, vomiting.
instead of
It's-
nausea with vomiting.
Right. So if this gets you hung up, if the E&M gets you hung up, look at your diagnosis codes.
That's
So
how
it was
I was
in-
able to get that one.
So it's D. All right, do you guys have 19? Number 19? Okay, so number 19, and test your knowledge. Ready? Got it? Sure you do. Okay, time. Let's pull it apart. all you need from this particular one is the fact that they did a microscopic examination. Okay? So go right to the first code, 88304, surgical pathology, gross and microscopic examination.
So that would be it.
That would be it.
Okay.
Because if you go to the other codes, 88329, 88348, 88333, they all have something to do with electron microscopy diagnostic, cytologic examination.
Yeah.
So you know you've got it right off the bat. All right. So how do you ladies feel about it? Feel better? Did it help? Do you want to do some more? Or you feel pretty good?
Yeah, I definitely need to make sure I get this email. If I don't already have it, I'll send you
Just send me a
back.
note.
I think I
Because I tried to make sure everyone got it. And I knew you were coming, so I tried to make sure I sent it. But that's okay. all
I'll go
right?
back and double check
That's
everything
okay.
again.
Okay, so this is extra work. All right, and if you want the answers, just email me and I'll send you the answers afterwards. But this gives you a different way of looking at them to get through the exam. Okay? Because remember, it's 5 hours and 40 minutes and it's going to be about time management. At this point in the class, I know all of you, every single one of you, knows your stuff.
I just get nervous and make
Yes.
stupid mistakes. That's when I get frustrated with myself.
And I still do too. Okay? So everyone is different and has to get past that anxiety of the time. And that's why I try to do it, a little bit, and I encourage you to use the egg timer and stuff like that when you're at home doing it, because that's the way you're going to be able to get past that fear. Okay? But I know all of you have the resources available. You've tabbed, highlighted, and made notes, and you can do it. I've seen you work. I see your grades. I know all of you can do it. It's that second guessing. It's that not reading enough. Okay? And hopefully, some of these things that we did here tonight will help you. So from here on out, when you're doing your exercises, see if you can't use this same method. Because I don't really teach it early on, because you have to know how to look the stuff up.
Right.
And we don't have those types of multiple choices early on. You have to learn to look it up.
That was hard for me not going to the index. I keep going back, like when I was doing the
I do
exam
too.
today, I go back to the index to check and see if there was something there that I needed to know. Like sometimes you go in there and it's a little vague when you get to the thing, so I go with the code right to the code. But then I'm thinking, well, what if the index was like really clear? If I could check the index.
I keep
Right.
doing that too.
It's going to cost you time if you do that.
Yeah.
And it's time that you don't want to waste. So sadly, when it comes to the national exam, do not use the index. Use the codes and the method of deduction. Okay, whatever works for you. Because everyone is different. You saw exactly how everyone is different. The op reports, if those are the ones that get you all the time, practice with those. Okay? But definitely finish the review book before you move on to the final exam. The mock exam I'm trying to schedule for the 16th. I have been waiting for confirmation on a room, and that will, if that doesn't work for everyone, you can definitely sit for the national exam and then do the lecture again, because the lecture is recorded, and hopefully you'll get some tips from that. I do have some AAPC exams that I'm happy to share with all of you for extra practice, but I encourage that it is timed. I want you to time yourself, okay?
I'd love an extra one, because that's a big deal for me. I get really nervous about it. I'm actually sitting for the exam in Bangor on the 16th,
Okay,
so I can't come to the mock exam, but I can do the one in my book.
perfect.
And if I have time left over, because I have like a whole list of everything I'm cramming in,
Yeah.
but if I have time left over, I would like to take another day to do one more exam before I go up.
Nope, exactly. The back of your CPC review book, or in the front here,
Do we have the exams, the answers to the mock exam in here? Is it in the back?
no.
So I have to go to you to get the answers
No.
to the mock exam?
You go on to Evolve and enter your answers, and it will
Okay.
give you,
And then it tells you. So
It'll
I
give you-
time it, finish it, and then I
Yes.
enter it manually.
yes. So if you look on page 484 in the back of your CPC review book, it actually tells you, it basically covers everything I've talked to you about. You have 3 opportunities to practice taking the exam, the pre, the post, and the final. For the purposes of this text, there are 2 practice exam formats that have been developed so you can focus on the exam format that most closely resembles the certification exam you have chosen to take.
What page are you on?
484 in the back of your book. So exam format A and then exam format B. This is the pre, the post, and the final. Then you should have the following manuals, your ICD-9, your HCPCS, your CPT book. There is not any other reference material allowed in the practice exams. For all of your pre, post, and final, you will need a computer that has internet access. For the exam format A, for the final exam, you will also need paper, pencils, and an eraser. So again, when you take the final exam, do it out of the book,
Okay.
then go on to Evolve and put your answers in,
Okay.
and that's how you get your score,
Okay.
okay?
Okay, write
You need
that down.
107 out of 150 to score 70 or above. There are some ICD-10 versions of the pre, post, and final exams under your student resources, but you don't really even need to worry about that. After you take your pre and post, you can look at your rationales to see what you got incorrect and why.
Do you know, because I've gone onto the computer to scrutinize it. I have the answer key now. Can I go back and see what I said?
Yeah.
And do it line by line? Because it didn't come up to show you.
You
got
should
that
be
one
able
wrong.
to, and they also offer you quizzes from every system so that you can take quizzes. I think they're 10-question quizzes
Okay.
to practice. And that's it. I mean,
I've got a question for you about the pre-post exam.
okay?
On number 87, I had a hard time with this one. I don't know
Alright.
if there's something you can say to make the light bulb go off.
Let's see.
But it says 21-year-old female seen in the clinic for a colposcopy. That should have been it. I should have just stopped right there.
87?
Yeah. Number 87. Took multiple biopsies of the cervix uteri, and that's where I got messed up. And then I have to assign a code for the cervix. So in my CPT book, when I got to those codes, where they are. Here we go. The answer was 57455.
Right.
But actually, I think that may be the one I did. But I remember having a really hard time with it. They're talking about the rationalization for it. It would not be 56821 because that was the vulva. I knew that.
Yeah,
It would not be 57421.
because it's biopsies of the vagina. And
Right.
there was no indication that they did an entire exam of the vagina. 57456 is an examination of the cervix with scraping, which was not indicated in the case. So your 57455 actually reports the colposcopy with the biopsy of the cervix. So they planned the cervical biopsy, limiting it to the cervix and not involving the vulva or the entire vagina.
So the entire vagina being 420
Right.
versus the 454, which is where I was getting, versus 452. What was the answer?
455.
455. Biopsy of the cervix. So 420 is actually more of a service than 455. They're actually looking at more tissue in the 420 than they are in the 455. It says the entire vagina with cervix
Yeah.
at present. And I'm thinking you got to go through the vagina to get to the cervix, but maybe I'm not doing that right. Because the cervix is the cervix of the uterus.
Right. Let me just look at the code.
I just thought they were awfully similar.
Yeah.
And I'm thinking they didn't really care about the vagina at all. So I was
They
willing to
didn't.
rule out 420 because all they cared about was the cervix.
And they're telling you specifically that they're taking multiple biopsies of the cervix uteri. They're not even mentioning anything about the vagina.
So one is more about the vagina and one is more about the cervix, even though you're kind of in the same neighborhood, regardless of which procedure you're doing, you're kind of in the same area.
Okay, so here it is. Look at your category. Your category for 57455 is cervix uteri.
Mm-hmm. And the other one is the category for vagina, probably. Yeah, it is.
Yes.
Okay.
So that right there should tell you.
Okay.
When that's another when in doubt moment. What's in the exercise? Am I under the right category?
Yeah, I'm good with that. That helps.
Okay.
I just need a trick for everything I get wrong. So
Yep.
I'm trying to look. I'm okay with it. That's the right answer. I get it.
Yep.
But how am I going to keep myself from making the same mistake again? And I didn't know how I was going to do that.
What is it? When you're walking, don't look down all the time. So when you're looking for your codes, look up, see if you're in the right category.
Yep.
Okay. Because if you look at 57420, it is actually endoscopy and laparoscopy. So, all right. So I want to thank you, ladies, for your time tonight. I really appreciate it.
I've got one more question for you.
Sure.
Do you know anything about Practicode? On the AAP website, they say that you can do a practicum and go through all of these for after my exam, not
Right.
before my
It's
exam,
for like an apprenticeship.
to get rid of my A.
Yes. I don't know anything about it because I didn't have to do that. I do know that there have been people who have done it. It's just being motivated to do it on your own. It would, if I'm understanding it correctly, you have case studies that you basically are sitting there coding.
Right. So it's like going to work.
Yes.
That's what I was thinking it would be like.
Yes.
So while I'm waiting to be interviewed, I thought I would do that to try to get rid of my A.
Yeah.
It looked like a really good idea as far as changing from multiple choice questions to earning
Yes.
a living.
Yes. Yep. Nope. And then, if you can find some place that will allow you to help do some coding, check with. Yeah, let me think about that. I was going to say McKesson, but I don't know how many at-home jobs they allow to start off with.
I'm okay with working in the field at this point. I'm hoping that I'll be able to do that. I just don't know where McKesson is, and I'm guessing it's not near me.
Lewiston.
Yeah, it's a long drive for me.
Okay.
But as a temporary thing, if they wanted to do something, Waldo County General Hospital is hiring right now. I put in my application
Perfect.
a week ago, not even.
Okay.
I'm very intimidated by Maine Health's application process online.
Isn't it crazy?
There's quite a few of those hospitals that actually do, I've heard, only do remote coding, like Miles.
Really?
But the only one that was hiring right now was Waldo County. And they basically made me say, sure, you can go look at my medical file,
Really?
which I was thinking was a HIPAA violation. But they want to know if I'm crazy or drug addicted.
Right.
And they figured they have a right to look at my medical file to find that out as opposed to just drug test me, which I also agreed to,
Mm-hmm.
along with credit reports and all this other stuff. And I was like, holy cow, they really just want my
They
entire
Want
life.
your life. They do.
And I thought that was a bit excessive, but I said yes anyway.
Yeah.
I want the job.
Well, that's the process that we're going through. Unless you're ending up in a single doctor office, you're going through jumping through hoops for that type of stuff. Because they have to be accredited and they have to show that they are, holding us all accountable for HIPAA, security, privacy, all of that.
I was nervous about, honestly, once I got halfway through the application, applying until I got my CPC, because I figured I look like they're going to throw me out without it. But I tried to put in there and squeeze in there that I'm getting it, I'm just almost there. And I'm like, if they just pull the trigger because they looked at yes, no boxes, they won't even look at it. But if they look at it and see, well, no, but she's just like within 2 weeks going to have it. And then I figured once I get it, I'll go back in and update my application.
Yep.
But, I'm kind of like wanting to be there already.
I know.
So I wasn't sure what was the right thing. My job coach keeps telling me not to wait for anything, just keep
Don't
pushing
wait
through
for
it.
anything.
And I also was very tempted to just send my cover letter resumes to the hospitals individually instead of to the online application. But with Friends of Human Resources, I just figured it's a waste of time.
They want you to follow their process because they want to know if you're following what they want.
They say don't call and then you don't call. So I was doing what I know is the right thing, but I don't like it.
Yeah.
I need a back door.
I know. So, you all know how to reach me. Email. And I look forward to hearing from each and every one of you about how you did, how you felt about it, because I don't get your grades. I don't know if you passed or failed unless you tell me. The AAPC does not send us a report of all of our students, this is who passed.
Oh, I'll tell you.
Okay? Okay? So, because it's exciting for me too.
I'm either bragging or I'm crying and asking
Yes,
for help.
exactly.
Either way, you gotta know.
Yeah, it's exciting for me too.